Hi guys, happy Tuesday. Sorry, I'm a few minutes late. I was pulling together my talk for today, so hopefully it's fresh on my memory. Um, I have had a great clinic day, and I hope you've had a great day enjoying some sunshine. It's nice to have windows so I can get out and see that sunshine. We're wrapping up February, and February is Heart Awareness Month. We want to be aware of all things heart. We've talked about several different studies, things that cause heart disease. We looked at women's health and how that connection is with heart disease. If you missed any of our lives from February, go back and check them out because they were definitely worth it. I've been wanting to talk about this study for a while and I just haven't got around to it. And I actually found two other studies heart related that I want to talk about. So I'm probably going to include them in March, even though it's not heart awareness, but I had to get this one out while I was thinking about it. We know that heart disease is one of the number one, if not the number one killer here in the US. And we've established that that is largely due to insulin resistance and consuming too many products that increase inflammation and worsen this insulin resistance or cause hyperinsulinemia. But there's this question of what do you do if, say, all right, I've changed my diet and I've done all the good things to make myself healthier, but I can't erase the 30, 20, 10 years, whatnot, that came before that change. What can I do to help make a dent in those? I know I can stop it going forward with what I'm doing, but what about those past years? I'm going to start by saying this is not direct medical advice. This is just general advice, relaying information that came from one study. If you want my direct medical advice on whether or not you should take this product that we're talking about, then you're going to have to consult with me individually. But you can also print out this study for yourself and take it to your individual doctors and see what they think about it. So the study that I'm looking at, it was published in Frontiers in Cardiovascular Medicine in 2022, and it is titled Effective Management of Atherosclerosis Progress and Hyperlipidemia with Nattokinase, a clinical study with 1,062 participants. And this study was done in China. So atherosclerosis is that plaque buildup in the heart. And as the plaque builds up, it closes off and can create a heart disease, but also hardens the arteries along the way, leads to more things like blood pressure, can also lead to kidney issues, impaired renal function, that kind of thing. So this study is specifically looking at nattokinase and what can that do. So nattokinase is the main active ingredient in natto, which who knows what natto is? It is a fermented soybean product that is very popular in Japan, something they frequently eat in Japan. And it was discovered in 1987 that nattokinase was, not natto, they've been eating natto a while, just the nattokinase, the main active ingredient. In Japan, it's been thought for years that this is a longevity food, that it helps people live a long and healthy life. They really didn't know all the details of it, and we're still discovering all the details with it. We do know that nattokinase has a potent fibrolytic effect. So fibrolytic meaning it helps to dissolve clots, helps to break them down. Think of aspirin as being a fibrolytic. It helps to dissolve and keep clots from forming and to break them down. It's demonstrated multiple cardiovascular events throughout the years, and that would be things like it's an antihypertensive or it lowers blood pressure. It's been shown in other studies to be an atherosclerotic, so it helps to break down the plaque. It has demonstrated neuroprotective effects, so protective of our cognitive function, and lipid lowering. Helps to lower lipids. Even though I established in my previous ones that they're not our number one thing we're going at for cardiovascular disease, it does help to lower them. So this was a retrospective analysis. So they enrolled people who were already on nattokinase and looked at the progress that they had made on that time. There was 1,062 people, as I mentioned, and it was fairly evenly split between males and females. They enrolled 491 males and 571 females. To be in the study, they had to meet certain criteria. The first is they had to have evidence of hyperlipidemia or elevated cholesterol, and this was even before going on the nattokinase. They had to have records that shows this. They had to have blood work and ultrasounds of the carotid artery, the main artery in the neck, before starting nattokinase and 12 months after. So if they didn't have those things, they couldn't be part of this study where they were going back and looking at the effects after the effect. And they had to be taking the recommended dose for this study consistently for 12 months to be enrolled. Now, the normal recommended dose of nattokinase is around 2,000. But for this study in particular, they're looking at closer to, and that's 2,000 FUs a day, and not FU in a bad way, but FUs in units kind of thing. But 10,800 is what they're recommending for this study. So it's a much higher dose than the normal standard dose that people are recommending or that other supplements are recommending. So I'm not going to bore you with the details because really it's just a lot of data pulling. We're just going to go straight to the findings of what this showed for nattokinase. The first one is that there was no difference between males and females. So the effects that they saw were equal in both genders. So there's no gender difference when it comes to nattokinase and the findings that they found. When it comes to cholesterol, they found that it decreased total cholesterol by 15.9%. It decreased total triglycerides by 15.3%, and it decreased LDL by 18.1%. And those are pretty big decreases, larger than some of our prescription medications actually give us for cholesterols. When it comes to the carotid artery, they looked at the intima thickness, so the thickness of the walls of the carotid artery, and they also looked at plaque size, so how much plaque was filling in those carotid artery walls in between in the lumen, the vessel, the opening there. And they found that this dose of nattokinase decreased both. So it made the thickness of the wall less because you can store plaque and fat inside the walls of the lumen. And it also decreased the plaque size, the total plaque measurement in the opening, the vessel opening for the carotid arteries there. They found, they did a control group that had less, that was taking less than that 10,800 units a day. And they found that the doses under the recommended, their recommended of the 10,800 were not effective. They did not decrease plaque. They did not decrease lipids. It didn't show any effect until you got up to this 10,800 units in a day. They also found that if you were exercising in addition to taking the nattokinase, there was a synergistic effect. You had an even better effect than those that weren't exercising. So you might have a higher percentage decrease on your lipids and size of that plaque artery that was in there. If you also took vitamin K2, and this is something that I've recommended in the clinic for a while. So K2 helps us keep our calcium where it belongs, inside of our bones, out of our arteries, out of our kidneys, from kidney stones, things like that. And if they found that the people who were taking vitamin K2 and this nattokinase dose at the same time had a more synergistic effect at lowering it. So they actually lowered more than the people that were just taking nattokinase alone. There was also a small group in this study that were taking aspirin, like a low dose aspirin. Now, when we think low dose here in the US, it's around 81 milligrams. Well, in this study, it was around 100 milligrams for their low dose aspirin. But when you took the nattokinase with the aspirin, you also had a synergistic effect, meaning you lowered it even further for your lipids and that plaque size that was there. This last finding is a pretty big one for me. There were no reported adverse events. So the people taking this higher dose than what's normally recommended did not have negative outcomes. They didn't start bleeding out their nose. They didn't start thinning their skin like we do with a lot of blood thinners that people have to be on. They didn't complain of a lot of GI issues, stomach issues, things like that. They really reported no adverse events from taking this higher dose that's there. Now, the authors admit that the mechanism of action for nattokinase is still poorly understood. We don't understand all the ins and out of it, but it's definitely worth looking into more research to figure that out. They think that most of its benefit comes in this anti-thrombolytic or anti-fibrinolytic component where it just helps to dissolve plaque. But also the lowering of the lipids is an interesting one too. And it's not just the LDL, it also lowered the triglycerides, which was an important finding that we found in our other studies we looked at this February, that triglycerides had a higher connection with having a heart event than even LDL. So the fact that it lowers both of them is great. And then when you combine it with other things like healthy exercise and other supplements, you get an even bigger synergistic effect. So I'm excited about nattokinase. It is something that I've recommended for several of my patients looking into prevention and also trying to reverse some plaque buildup there. Once again, this is not direct medical advice. Amanda's not telling you to go out and buy nattokinase and take it. If you want my opinion on if it's right for you in particular, you're going to have to consult with me. If you do want to consult with us, check us out at our website, clearpathmedical.net. You can also shoot us an email at contact@clearpathmedical.net. Remember, we have Low Carb for Better Health coming up in September. It is going to be a fabulous event, and we have two heart specialists. One is a cholesterol specialist, and one is a true cardiothoracic surgeon. So please sign up and join us. You can find that at lc4bh.com. So that's LC, the number 4bh.com. And it has the link straight to tickets and to get your lodging at Montgomery Bell. It's been a fabulous event the last years that we've done it, and I can't wait for this one. So I hope you guys have a great rest of the week and that you stay very healthy. Next week, I've got a little treat coming. It's an interview. I'm going to take a break from studies and have more of a lighter conversation concerning keto chow, which is something that a lot of low carb people use as a meal replacement shake. So I'm looking forward to that one. Join me next week at 5:05. See you there.